Good morning, everybody. I'm all psyched up today to be able to talk with you a little bit about the role of the GP in anxiety. Thank you for watching. My name's Dr. Brooklyn Storm. I'm the director and the head psychologist here at the practice. Normally I'll come to you at 11 o'clock, but I'm really excited because at 11 a.m. this morning, I have a really special phone call with somebody that I've just been dying to talk to. Her name is Mamie, and she is all about abundance mindset coaching and things like that. But I'll tell you a little bit about that later. Good morning, Jennifer. How are you? Hey, Karen. How are you going? If you have any questions, guys, about the role of the GP in anxiety or anything about anxiety, just let me know and I'll do my very best to answer it. So I guess hey Janelle, how are you? Good morning. I guess the role of the GP in anxiety is they're the gatekeeper, aren't they? I mean, they're our first port of call. When we're feeling anxious and we think that perhaps it's becoming quite a problem, what we're going to do is take ourselves down to the doctor. And, having that conversation with the doctor around the experiences that you're having can be a really tough one. But if you're able to have a good relationship with your doctor and be open with them and talk about some of the symptoms and some of the signs that you're experiencing, what you can expect is something like this. Quite often, not all the time, it depends on the doctor, but quite often they will ask you to book again and maybe book a long consultation. So a long consultation for Medicare terms means around 20 minutes. Good morning, Ali, how are you? And a standard consult is anything from 5 to 10. So you want a long consultation, that's number one. Otherwise, you won't get the time that you need in order to get the ball going in terms of the treatment for the condition. When you meet with the doctor, they're going to ask you all sorts of things like, how have you been feeling? Now, when you say, I think I've been feeling anxious, it's really important to articulate what that means for you. So are you saying that you've been feeling scared? Are you saying you've been feeling worried? Things like that. So be really, really thoughtful about how you describe the anxiety so that the doctor can understand what it's like for you. The doctor's also going to ask what sort of symptoms you've been experiencing. So it's really important to think about the things that have been going on for you. Maybe you've had difficulty getting off to sleep at night. Maybe you've been waking up a lot. Maybe you've been getting headaches. Maybe you've been getting belly aches. You've lost your appetite, or the opposite has happened and you're overeating a little bit now. So you want to tell the doctor all of those sorts of physiological things that are happening for you as a result of the anxiety. The doctor's also going to ask you, I guess, if there have been any sort of behavioural signs or symptoms that you've been experiencing. So he or she could say, have you needed time off work? Have you found that you've been having trouble concentrating? Are you finding that you're a little bit more moody or touchy or sensitive than you usually are? Things like that. And so the doctor's going to ask you about signs and symptoms for these three areas. So your thinking, your feeling, and your behaviours. And then if there's enough evidence there to suggest that maybe there is a little bit of anxiety, what the doctor might do is ask you to complete the DASS-21 or the K10. So I did walk you through both of those in the video on Thursday last week. So if you missed it, just scroll back through the feed and it will be in there. I explain to you everything about those assessments, what they look for and how they're administered, scored and interpreted. From there, a couple of things can happen. So the doctor might decide that he wants or she wants to do a blood test and just check that everything's okay with you medically, because sometimes there are some medical conditions that can, I guess, give us the experience of anxiety or can perhaps show us similar signs and symptoms. So for example, thyroid conditions can certainly play a role in mood and how we're feeling and in energy, and sometimes that can be perceived by us to be depression or anxiety, but it might not be. It could just be the thyroid, so, or iron levels and things like that. So what's going to happen is, good morning, Bev, the doctor will also take some bloods and then offer you a referral to see a psychologist. So usually they will give you 2 or 3 different psychologists in your area that you can choose from, and they'll talk with you about what each psychologist's area of interest is or who they recommend would be a great fit for you. And then you just go and book yourself in. So after that, what happens is the role of the GP is then to monitor. So at our practice, what we encourage all of our clients to do is pop back and see their doctor. So as soon as we get the referral in and we've met with our clients, we will send the doctor a letter to say, yep, we've met with them, this is what we're going to do from our side, so that this means that the doctor and the psychologist can be on the same page with the treatment. We recommend to the client that they visit their GP on a regular basis for monitoring. So some people want to do that weekly for a while or fortnightly, some just go monthly, but there needs to be some consistency so that the doctor gets a clear picture of you and your functioning and where you're at, so that when things do go pear-shaped, they understand what's going on. Oh yes, Karen's saying, or you can get a referral to an accredited mental health social worker. That's so true, and they're absolutely awesome. And I spoke to an amazing social worker this morning. G'day Wendy, if you're watching. So yeah, there are so many different ways that the GP can support you. So then what happens is, if you've got a referral to see a social worker or a psychologist on a mental health care plan, they have an obligation to keep in touch with your doctor at the 5th or the 6th session. Usually it's number 6, but some doctors want us to be in touch with them at number 5. And we will send that doctor an update about your progress, what's been happening with you, what treatment we've provided, the progress that you've made, and the prognosis. And then you will book another long consultation for your GP, and the GP will sit down and talk with you about how you feel you've been going. And then they'll give you what's called a review, and that allows you to have the remaining 4 sessions, or sometimes it's 5, for the plan for that year. So that's all really exciting. But I think the role of the GP is really to look at, your functioning, to check that there's nothing medically going on that could be causing your experience at the moment for the anxiety, and to monitor, provide onward referral, and also to discuss and administer appropriate medication. That's not my field, so I'm not going to talk about that. But if you have queries about medicines for anxiety, your doctor is ultimately one of the better ones to talk to. If you're already on medication, perhaps, and you've got queries about that, and you've not seen a psychiatrist before, you might want to touch base with a psychiatrist, and you can absolutely do that and get bulk billing for some of the referrals, depending on the item number that the GP pops on the referral letter. So you want to look for an item number 291 or an item number 293 that will allow you to get quite a portion of the psychiatrist fee back. And you can discuss that with your doctor. Both the item numbers mean something different. One item number is for the psychiatrist assessment, and the other item number is for ongoing treatment and management with a psychiatrist. You can access a bulk billing with a psychiatrist twice a year. So, okay, I'm running out of puff now, and I'm just conscious of the time because my next client's here and I've got to go. But I hope you all have a really wonderful day. Thank you so much for stopping by and saying g'day. We're doing something really exciting. We're doing a little bit of an experiment today where we're going to just keep our eyes and ears open for something amazing that might happen. And, you're most welcome to participate in this too. You just jump on the Facebook page. You can head to my personal one. It's just Brooklyn Gabe, or you can head over to the business one, which is All Psyched Up. And, what we're going to do is a whole bunch of us are just going to be on the lookout for something amazing that happens to us today. We're just trying to bring good things up into our awareness, get some good energy going. And then at the end of the day, we're just going to drop some comments in the comments box to update each other on the amazing things that happened. So already it's been an amazing morning for me because I got to talk to you guys. And I think that's really cool. Anyway, have an awesome day. Thank you for the likes and the loves. And I'll see you on Thursday at 11. I promise I won't be late. Bye.